Yeah, my name is Holm. I'm a consultant psychiatrist and professor of psychiatry. I'm editor of Global Psychiatry Archives. And this is a paper about the factor structure of the Albanian version of the clinical assessment interview for negative symptoms, CAINS. And it also looks at the brief symptoms inventory. However, I will focus on the results of the CAINS. That's in Albanian. So it has been translated from English into Albanian and back translated. This is a common approach. 106 patients were assessed who all suffered with psychosis. I come to the sample in a bit, and sometimes it's quite easy to look at the tables instead of looking through all the data. So what you have here, we have 106 participants, all psychotic patients with mental health problems, psychotic symptoms, 68% male, 32 female, most of them single, divorced, or widows, most of them unemployed, and nearly half of them without secondary or primary school education. And the diagnoses were more or less in the schizophrenia area. So what does an factor analysis does? It looks whether there's a specific factors of a sample of different questions which correlate with itself. And if there is a specific eigenvalue, which means more or less a correlation between different questions, then you can see that this is a specific factor. Let's say that way, if correlation is very high, let's say 0.9, then more or less the same, it belongs to the same factor. So if two questions and their scores have more or less the same value, then it's not necessary to have two different questions. And if, let's say, there is no correlation between two questions or sample of questions, then they belong to a different factor. So usually this is summarized in a spree plot, and usually an eigenvalue of 1 indicates as a specific factor. So, and I don't want to go to these BSI subscales, but I'd like to indicate the factors or the number of factors which have been found in the CAINS. So usually what you can see that, they have an eigenvalue of, the first factor has an eigenvalue of 5, and it explains 39% of the variance. There's a second factor which has an eigenvalue of 1.9 or nearly 2. Explains 15% of the variance, and altogether, both together, that's 54%. The third and the fourth factor, and all these factors explain 74 or nearly 75% of the variance in the scale. So, and these are the factors, that's a BS, these are the questions. And so there is one factor which is called expression. So it's a quantity of speech, vocal expression, facial expression, and gestures. Then there is motivation and pleasure. So these factors are called, so the 4 factors are expression, motivation and pleasure social, motivation and pleasure recreational, and motivation and pleasure vocational. What you can see, let's go to the MAP social. What you can see then, these are the individual CAINS items which belong to these factors and which correlate to with the main score of this specific factor. So these are the individual questions, and the main factor is MAP social. That means motivation and pleasure in social area. Right, okay, and then so you can see which items belong to that. So 4 items which belong to the expression, 4 items motivation and pleasure social, 3 items MAP recreationals, and 2 MAP work and school. So overall, and then you check what's the internal correlation within the factor, and then you can see this is, expression has a very high internal consistency. So what we show here altogether is we have quite a few social factors, social expression subfactors, expression social MAP, recreational MAP, and work exposure, so school motivation and pleasure factors. So that's shows that the Albanian version of the CAINS scale has 4 factors, which is slightly different to the German, Chinese, and other versions. So if you're interested into this paper, just feel free to look at the journal. I just come to the cover page. So this is in May 2020, published in Global Psychiatry Archives. And if you're interested, check it on www.globalpsychiatry.co.uk. And if you're interested in learning what we published and having interesting information and clarification of individual papers, please subscribe to this channel. I hope you enjoyed it, and thanks a lot.